Well, hello there and welcome back. Thank you for joining us in the next video, which we will talk about the answer to case 1 of the clinical psychiatry cases. As you already know, we get our cases from the DSM-5 clinical cases book, which was edited by John W. Barnhill. And today we're going to be discussing the answers to the case 1, which was called unfairness. If you don't know the case, go back to the previous video and you'll read about the details. Today we're going to discuss, and it's going to start basically with the answer. And the answer to this case, or what this man seems to have, is antisocial personality disorder. Now, what is antisocial personality disorder? Very, very frankly, we're not going to go into too much detail here. I'm trying to be as concise as possible. It is basically a person who has a pattern, a pervasive pattern throughout their whole life, probably starting from childhood to adolescence, in which this person has a general disregard for and violation of the rights of others, but in the form of breaking law, in forms of lying, in forms of many other things we're going to see. And what is characterized by, because not all of us are law-abiding citizens. Some of us break rules and the law, and we've got our own justifications. That doesn't necessarily mean that we're all antisocial personalities, but rather it is a person who has a significant trouble in functioning. Their life is not going good because of their pattern of behavior, okay, in different fields of life. For example, at work, at home, and with marriage and with family. So there's many aspects to the problem. It's not just one field that has a problem. We diagnose antisocial personality disorder if there is at least 3 out of the 7 criteria, and the patient has to be, or the person has to be, at least 18 years old. Below 18 years old, fulfilling such criteria, we would call them conduct disorder. And children or adolescents with conduct disorder don't necessarily have to go to become antisocial personality personality disorders. They don't have to, but it is correlated that they do. Okay, so here's the criteria. First of all, this person has repeatedly performed acts that are grounds for arrest. So basically they don't conform to the social norms in terms of abiding to the law. So they break the law, they steal, they commit crimes. Even if minor crimes, it's still considered as breaking the law. Okay, next thing is deceitfulness. Deceitfulness is basically a habit, a repeated habit of lying or conning people for personal profit or for pleasure. Then we have impulsivity, or basically the failure to plan ahead. So they just say, okay, right now I just feel like going on the highway and driving 100 meters per hour, 100 kilometers per hour, whatever. You know, they're impulsive, and that leads to this one here, which is a reckless disregard for the safety of self or others. So they might do very dangerous things, and part of those things is taking drugs. And people with personalities, with antisocial personality in particular, have a tendency to abuse medications and abuse illicit drugs that are dangerous to life. Then they have also a habit or a personality pervasive pattern of irritability and aggression. And we will see that later on in Mr. Crocker, who has shown that before. And that's just not one occasion of irritability or one occasion of aggression. It is a pervasive pattern. It is a chronic pattern. It is part of who they are. They're known as aggressive people. Consistent irresponsibility. Again, it's another thing that it's consistent. You're not just sometimes irresponsible. They're most of the time irresponsible. So for example, repeated failure to sustain consistent work behavior, or honor financial obligations, or honor marital obligations, for example. And finally, we have a lack of remorse. So after they've done all these things, they've lied to people, they've taken, dangerous action, they've broken the law, they don't have a sense of remorse. They're indifferent to what they did, or they rationalize what they did, having saying that they're hurt or they're mistreated or they've been framed or something. So it's a pattern of lack of guilt. So they break laws, they are a danger to themselves and to others, impulsive and aggressive, and they don't really feel guilty for any of it. Now let's see how this applies to Ike Crocker here, who has been employed at a large construction business. And the story began with basically that he has frequent arguments, absenteeism, poor workmanship, and multiple errors at work. Okay, doesn't sound too dangerous. Maybe he's an inexperienced person. So let's keep seeing what else is his problem. When he's confronted, he says he's dismissive. So he says, well, it's not my fault. It's probably due to cheap wood or bad management. Or if someone got hurt, it's probably due to their own stupidity. That kind of response makes you kind of think this person doesn't seem to have a lot of remorse, doesn't have a lot of regard for his actions. And then further on, when he's been confronted by the HR head and said, well, I think we might have to terminate your contract, he started saying, well, I've got a disorder, I've got ADHD, and I've got bipolar, and if you don't help me, if you don't grant me accommodation, I will sue you. So there's a sort of manipulation going on here, is starting to form threats. So when he's undergone a psychiatric kind of evaluation, he was saying, oh, this is not fair, this place is not good. So this is another sign of lack of remorse, okay? Or basically he's rationalizing what's going on by things are not fair. Now let's look at his other part. So we've looked at work here. He seems to have problems at work. Let's look at his marriages. He has had 2 marriages that have ended. Okay, so 2 marriages have ended. Oops. Okay, because of jealousy, apparently. Okay, and he says that his wives were always thinking I was with other women. That's why they both lied to judges. Okay, and so he's blaming his wives. We don't really know if his wives are actually both lying or not. We don't have evidence for that. However, most likely it seems, we don't want to be unfair, but most likely it seems that he's saying this as a justification. And he got restraining orders saying that he'd hit them. So this is a one of the criteria saying that there's aggression here. And he had jail time, and as payback for that, he refused to pay child support for his 2 kids, and he has failed to go see his kids. So apparently there's also a very clear sign of lack of social responsibility. He doesn't seem to care about his kids. He doesn't seem to fill the obligations that he should be fulfilling as a father. At the age of 14, he's spent time in juvenile hall. Juvenile hall is a place where kids who've committed crimes go. And for stealing. Stealing what? Stealing is stealing. And for him, he just rationalized it by saying, it's minor stuff. It's like tennis shoes, wallets that are practically empty. It's pretty much nothing. At the age of 15, he was framed for stealing a car. Okay, by his his principal, frankly, apparently, framed him. So there's here, clear. So there was an offense here about hitting his wives and whatever, and then here we have an offense with stealing. Here we have an offense for also another stealing of cars. Okay, which were all blamed on circumstance or on other people rather than on himself. We asked him about substance abuse, and he said that he smoked marijuana, and he said that he drinks alcohol on a regular basis, but he doesn't claim that it's a problem for him. Also, let's just skip down here, is that when we finished the interview with him, he requested medications himself, and he said that the only ones that worked were stimulants and a specific short-acting benzodiazepine. That also, that's a kind of a sign that makes you think, maybe, well, not maybe, pretty much, surely he knows he has some experience with medications or the wrong use of medications, like stimulants and benzos. So that could spark off another diagnosis that he might be abusing substance. So this is a substance problem also, not just a personality problem. And this is common to find people with personality disorders, particularly antisocial personalities, abusing substances and using substances wrong. Because part of actually their illness or part of the personality is that they have they take part in high risk behavior. He has mood swings, so he has ups and downs, and he got mad real fast, and he's a short memory. So this shows that he has mood swings, irritability, kind of. Yeah. Okay, so let's on mental status examination. He was casually dressed and everything. We assessed for any thought disorder, or hallucinations, like for example schizophrenia, psychosis, anything. But it seems that he was pretty okay. We kind of excluded mania, we exclude bipolar, and schizophrenia. His cognition is intact, but his insight is poor. And insight is poor typically in personality disorders, and why these people don't really seek help, because they just feel that they're okay. Now, so they've at the beginning here, when he initially applied for the job, he presented as a very motivated person, and he has 2 carpentry school certificates with high level of training and skill. When they checked up on his certificates, they found that he had been expelled actually from 2 carpentry training programs, and both his certificates were falsified. And that meets another criteria in which he showed the criteria number. Let's go back to the criteria. The deceitfulness here. Okay, so he's frankly lying, and he's using wrong fake documentation. And he had been fired from his job at one construction company because he had a fist fight. This is another sign of aggression with a supervisor. And again, when they reviewed his documentation from before, they found that it was the same false documentation. So here, Ike Crocker seems to have met pretty much all the criteria for antisocial personality disorder, in a form of repeatedly performing acts that are ground for arrest. Yes, he's committed crimes, like stealing, like hitting his wife, and all these things. Deceitfulness in the form of using, for example, for using false documents. Impulsivity in his actions, in his job. He goes into fistfights, and he just leaves his job abruptly. So this is a sign of impulsivity. Irritability and aggression, clear signs of that. Reckless disregard for the safety of self and others. Consistent irresponsibility in terms of, especially when he doesn't really care about his kids. He doesn't want to visit them or see them or pay for child support. And after all these things, he has a lack of remorse for what he has done. So we've kind of diagnosed him here. As for the treatment and everything else, usually personality disorders are treated usually by psychotherapy, or at least it's not a disease per se to be treated, but it can be managed, or the person can learn to live with their personality traits, and function at a slightly better level. But for a person with antisocial personality disorder, psychotherapy is particularly useless. But CBT, which is cognitive behavioral therapy, may benefit those with milder forms of the disorder. And basically it focuses on the patient's beliefs about himself and others. Some sort of behavioral modifications could be attempted. If the patient is if he is aggressive, then they do consider using antipsychotic medications. And there's been some studies done here on the use of mood stabilizers, like lithium, to decrease threatening behavior in prison inmates. It's been shown to be quite effective. And the use of SSRIs, and it's shown that it reduces a little bit of the aggression and irritability in these patients. But overall, it is not really a condition to be treated by medications. And that's pretty much it. Thank you for joining me in this case. I will be presenting case number 2 shortly, and thank you very much. Bye.